So we wanted to look at the question of whether oxygen was beneficial or harmful in people who are presenting with acute coronary syndromes. And this is actually quite a hard question to answer in normal care. It's actually a hard question to answer by doing a normal trial with individual randomisation. But we thought we could answer it by randomising protocols used in usual care. And that's the way we administer oxygen, and it needs to be administered right across the healthcare pathway in ambulances, emergency departments, catheterisations, labs and in CCUs. And so we thought we could address this question by implementing two protocols: a high oxygen protocol where oxygen was given high flow rates for ischemic chest pain irrespective of the oxygen saturation, and a low protocol where the oxygen was only given if the saturation was below 90%, so the patient was hypoxemic and just enough to get above that level. And we did this in usual care right across the healthcare system in New Zealand. Now, New Zealand's a small country, just under 5 million people, and we have a single healthcare system, integrated care. Everybody's managed in the same system, and there are pathways of care across the regions where everybody within that region would be managed. So we divided the country into the 4 regions where people might be managed, and we used these two protocols for about a year in each region, and then we used administrative data sets to find out what happened to people. And using this approach, we were able to compare the two strategies in a very large number of people, 40,000 people across the 2-year period, 20,000 in each protocol. And fortunately, it turned out the randomisation worked so that the groups were very well matched. And we found that the mortality at 30 days, which was the primary outcome, was almost exactly the same for the two protocols, suggesting that maybe oxygen doesn't have a beneficial effect, but also not a harmful effect for most patients. Now, when we did look further though, there were two groups of people who might benefit. And these are the people who have a lower than normal oxygen saturation. So we only had this data for about 10% of people, under 4,000 patients, who were, when they were first seen in the ambulance, their oxygen saturation level was below normal, less than 95%, but above the level at which the current guidelines say is hypoxemic, which is 90%. And these people had a much higher mortality, about a 10% mortality compared to only 2%. And there looked as if there could be a benefit from giving oxygen to these people, but even in this very large study, we couldn't be sure. So we're left with a little bit of uncertainty, but I think the key message is that there may be a benefit from oxygen for some people. You need a very large study to be sure, but we didn't find anything for harm, any evidence for harm.